Paul here from My Perfect Failure, helping you turn your failures into successes and your setbacks into opportunity. What if we're missing the most important piece of the health puzzle? Today I'm excited to bring you Evan Transue, someone who faced health struggles from the age of 5, yet turned those struggles into a mission to help others. Evan is also passionate about turning uncertainty into empowerment. He also shares his extraordinary health journey from severe panic attacks and migraines to navigating 7 different medical diagnoses by the age of 18. Evan also discusses functional diagnostic nutrition and how it can be used to help uncover the hidden contributors to poor health. He also reveals the key differences between Western and functional medicine and how a blend of both can aid our healing. So listen now wherever you get your podcast to discover other ways to think about your health.
Who knows what Jay-Z, J.K. Rowling, Bill Gates and Oprah Winfrey all have in common? Okay, I will tell you then. They have all overcome failure in one shape or form to go on to gain success in their respective careers. Welcome to My Perfect Failure. Join us as we delve into the world of our perfect failures. We will interview, explore, and discuss how our perfect failures can lead us to success. Join us and tune in.
Welcome everybody to another episode of My Perfect Failure. Today I am very excited as I have another fantastic guest for you. So my guest today is the host of the Health Detective podcast and owner of Bucks County Light Therapy Functional Medicine Center. He graduated from Functional Diagnostic Nutrition in 2017. Prior to finding FDN, he and his mum had suffered with a variety of health challenges for over a decade. The FDN system transformed his and his mother's lives so profoundly that all his work is now centered around speaking its teachings for other people. He speaks professionally to middle and high school students about mental health challenges, and to date he has spoken to over 50,000 students. So a very, very warm welcome to My Perfect Failure, Evan Transue. How are you, Evan?
I'm doing well, Paul. Thank you so much for having me today.
Well, excited to have you on My Perfect Failure and to have an enlightening discussion. I've listened to your podcast, which is fantastic, and like I'll do with every guest, I've researched you. So I'm fascinated to learn some things today, which, that I have very little idea around. So it'd be lovely to capture some of those insights from you. But from everybody listening, watching, the episode today is Decoding Health Mysteries. So listening to your podcast, which I love, by the way, and you've got a really natural tone, and you get your passion for your subject when you listen to your episodes. Get that immediately. I listen to a lot of podcasts which are great, but you don't always get that. So definitely I will leave a link to your podcast in the show notes for other people to listen, learn, and get a feel for your appetite for your subject. What I was keen to get into at the start is a little bit about your background, because you've got this passion for health. So where did it all start for you?
So it all started at 5 years old. So we're going way back. And that's when I started to deal with my first health challenges. I did not have labels for all of these things then. Some were obvious. I suffered with migraines, and not every day. And I'll specify that in a second. But none of these things I'm about to list were every day. But I started to deal with migraines. I'd get these severe stomach pains. And then the one that didn't have a label for myself or my parents or family members at the time was what we now know were panic attacks. So these were already starting for me at 5 years old. And I mention this for a reason, because I think it's important the longer we do the podcast together I actually had a pretty privileged life. I don't mean rich where we're driving BMWs and all that crap. That's not what I'm saying. But I mean, I have two parents that love each other. They are still together to this day, high school sweethearts. They treated me very well. We certainly had food. We certainly had clothes. We felt safe in our house. So you have all these things that statistically are actually very favorable, especially for like mental health. That for mental health outcomes, those are very favorable things to have. And yet I'm already exhibiting these symptoms. And so we went to the doctor mostly for the panic attacks at 5. And I probably remember one or two things from 5 years old overall. But the one thing I definitely remember is going into that doctor's office. And the doctor said to myself and my parents, this isn't something to worry about. Evan gets himself a little too worked up and he's going to outgrow this. This was not a bad doctor who knew I had panic attacks and said, hey, I want to torture this kid. Guys, it doesn't work like that. That's not what he was doing. He truly missed it. And I think people forget this sometimes, especially if they're not in the health space. Western medicine folks are fallible people, just like the rest of us.
Yeah,
they make
absolutely.
mistakes, just like the rest of us. They do all that education so that they don't make them, but it does happen. So that statement, though, Paul, was so powerful because I didn't get better. I got a lot worse. And as those years continued on and I found myself getting worse, I started to conclude, if smart doctor can't figure it out, maybe Evan Transue is the problem. So that's really where this all began.
And it's difficult when we go to the experts and the experts give us their appraisal of what the situation is. We don't really challenge them. It's very invariably, we only really challenge them when the situation is continuous, and it goes on and on and on. Then you think, well, maybe I need to go back. So I've just written down or scribbled down siblings or maybe family. So the condition that you had, the panic attacks and everything that was going on that you were exhibiting, I don't know whether you have siblings. Did you have siblings that might have had the same challenge, or was there anything in the family tree where you could have looked back to see whether there was anything there?
Well, sure. At the time, no, I wouldn't have been able to see those things clearly. One, my sister was too young at the time. She's 3.5 years younger to the day. And so if I'm 5,
really?
She's really young.
Yeah.
But as I got older, I was starting to catch on certain things. My parents, never really told me that maybe my mom dealt with some mental health stuff. Okay. So I started to see that the older I got. And my sister definitely had her own variety of things. But a lot of this, it wasn't even that the family wasn't close. So much of this came down to the societal stigma around all of these things that it affected our family. We didn't talk about these things because you're supposed to be, and if you're listening on audio, I did air quotes, I don't believe this. You're supposed to be ashamed. You're supposed to hide this. You're not supposed to talk about that. So I grew up in that era, which I guess most people did. It's really only been the last several years that you actually see people openly talking about mental health more and more because it's become such a big problem. But I couldn't make those connections at the time, not because they didn't exist. They did, I found out, but everyone was kind of hiding their own stuff or underplaying what was actually going on. And I think we do that to ourselves too. It's not that, my mom knew something about herself, for example, and then was hiding it from me completely. I think she underplayed the things that she experienced in the same way that I underplayed the things I experienced.
Yeah. And potentially, or maybe she hoped that maybe what you were exhibiting wasn't maybe what she'd suffered, or maybe she just hoped that it might be something that might be passing. And when you go and see a doctor and they say it will pass, because they do say that at times, it will pass. You kind of hope that as parents, you kind of hope that. What you know now, or looking back then, in relation to doctors, do you just think that doctors weren't that educated around it, or whether they just didn't want to really investigate it? Do you have any thoughts what was going on there?
I love that question because no one ever asks that. And the answer is they are subject to the same societal stigma that we are. Now, yes, they are more educated. I get that. But people, again, when their doctor is not wearing that little white lab coat or whatever they wear in your office, they're going out on family vacations. They're going out to a home. They might have kids. They have recreational things that they like to do. So they are as much human as me and you. And just because they're more educated doesn't mean that they're not subject to the same things. So my point in answering it that way is I've asked myself this several times over the years of healing. I'm like, how did that happen? How would a doctor miss it? Well, he's seeing the same things that on paper are statistically good indicators that I wouldn't deal with mental health issues. Hey, Evan's coming in. He's not getting hit or abused at home or something. He's got two parents that care enough to bring him in. I think they miss that too. And then, not to mention, until really the last 4 or 5 years, with the pandemic being a huge trigger for this, I would imagine, or I kind of think it's the sole trigger for a lot of this stuff, you didn't hear about mental health conditions as much. So there are certain people that were dealing with these symptoms or even straight up diagnoses. They might have met the criteria for a diagnosis that never went into Western medicine. So I imagine, I don't know the exact numbers, but I would have to imagine a doctor a year after the pandemic is probably seeing 3 or 4x the amount of people for depression or anxiety than they ever did. Now, does that mean 3 or 4 times more people actually had it a year after the pandemic than did before? No, I think it's higher, but I don't think it's 3 or 4x. I think people started to see celebrities talk about it, or, myself, like mental health speaking now is like a cool thing to do. When I was in school, you had one speaker at my school. He came in for suicide. One time I was there, which is very important. I'm not underplaying that. We never had someone come in and talk generally about mental health. A lot of the schools that I go to now, Paul, they bring in myself or colleagues that are speakers every single year, sometimes multiple times a year, to make sure these kids are educated. So the real answer is these doctors are subject to the same societal stigma that the rest of us are subject to. And quite frankly, I just don't think as many people were coming in for mental health issues 23 years ago as might have been 2 years ago. That's my answer for that.
Yeah. So with that in mind, do you think that there is a need for doctors to have some level of training, some upskilling?
I can't answer that fully, but I do have something. So I know things have obviously moved in a positive direction just because, and I don't recommend this, but as someone who got very into holistic health, I probably don't go for routine physicals as much as I should. I check a lot of the stuff myself. So I'm not recommending that to the listener, but I'm trained in this and I've done it for a while. So I did go for a routine physical last September 2023, simply because I knew that I was doing a lot of sports. I still am. So if I need a referral to like a physical therapist, at least that's how it works in America, you want to have a good relationship with your primary physician. And I hadn't been in like 5 years at that point. So I went in just for routine stuff. There's nothing wrong with me whatsoever. And they actually went through a questionnaire that I could totally tell as someone who's educated on it, a depression screening and an anxiety screening. Now, they can't sit there and screen for every mental health condition that exists. There's a lot that actually are out there. But the fact that they even asked and tried, I mean, God bless them. They're doing the right thing. They're attempting to do this. They only have so much time with each client. It really is like a revolving door type of practice here. I was in there for probably 5-10 minutes on my physicals over, at least 5 to 10 minutes with the doctor is what I mean. So I would say that they're doing a lot better with that. I couldn't give a more specific answer in that area. What I would say is, now we're always a little step behind. So now the next level of this is, okay, good. We're screening for depression, anxiety, and all that stuff more. That's awesome. But are we just going to throw blanket medications at every single person that answers yes or like incorrectly to those questions on the questionnaire? Or are we going to ask, hey, why does a 5-year-old have panic attacks when on paper he is not at risk for developing mental health issues? Could it be something more than just genetics, or better yet, maybe it is genetics, but maybe we can do something with the genetics from an environmental perspective by changing the food or modifying the lifestyle. So we're like 1,000 steps behind that in Western medicine. But I would say that's going to be the next thing that needs to change, is just saying, a 15-year-old came in and said yes to the depression questions, instead of just throwing them in SSRI, which I think has its time and place. I piss a lot of people off in the holistic space by saying this stuff, but I do believe that has a time and place.
What is that? An SRI?
I'm sorry. That's a common class of antidepressants. So it stands for selective serotonin reuptake inhibitors. This would be your Prozacs, Zolofts, Celexis. People have probably heard about that.
Yeah.
And so what they'll do is, they just kind of throw these things somewhat blanketly, but then they'll never even ask. Let's say, again, let's a 15-year-old comes in and answers yes to those questions. Okay, 15-year-old, are you staying up past 12 a.m.? And I know that sounds so simple, but we know that people under the age of 18 that stay up consistently past 12 a.m. are 42% more likely to be diagnosed with depression. We know that blood sugar imbalances can manifest as anxiety symptoms. Are we asking them about what their diet is? Now, one might counter that argument and say, hey, a 15-year-old doesn't want to change their diet or their sleep, and in 5 to 10 minutes at a doctor's office, you're not going to be able to modify that. Well, fair enough. But my mission, Paul, really is I kind of call it leveling the playing field. And what leveling the playing field means to me is giving someone all of the information so that they can make an informed decision. If you want to tell the 15-year-old and their parents that, hey, just so you know, there are studies showing that these foods could help mental health conditions. There are studies showing that getting to bed at the proper time could significantly impact your mental health, and you don't want to do it, that's fine. That's a personal choice. But the fact that they never even get educated on that and then get given medications that have some very severe side effects sometimes, that's not, I don't like that. That's where I disagree.
Okay. Yeah. So it seems to me, based on what the wonderful insights you provided, that it's not a very holistic process at the moment. If you're diagnosed and they think, well, I think Paul's got depression or he's having panic attacks, they will just give you medication, but they won't actually say to you, what time are you going to bed? What foods are you eating? Do they not go down that road? Which to me, particularly if those insights are out there, it's like, why wouldn't you ask those questions?
Well, I think it's the system itself that they're in. So the system of allopathic medicine, Western medicine, is to diagnose and then we treat. And that is how we do it. And that's why they're able to do 5 to 10 minutes in the office. They're looking for a cluster of symptoms based on either what you're complaining about or what you're not complaining about. Maybe you went in for a physical and all of a sudden you walk out with a prescription. Now, once we meet that diagnosis of something that insurance recognizes, we slap the label or labels on it. Now I can bill your insurance for this medication or surgery or whatever, and you're good to go. And I've helped you to the degree that I'm able. So to give legitimate sympathy and empathy to the Western medicine professionals, doctors don't have enough time to actually investigate all this stuff. When we're taking clients as FDN practitioners, functional diagnostic nutrition practitioners, everyone works a little bit differently, but let's put it this way, Paul, when I do an intake call with someone, I don't even charge money, and that thing takes 45 minutes to do. I spend 45 minutes with the person just seeing if I can help them with my knowledge base or if I need to refer them to somewhere else, and I don't even charge for that. So you have to think about it. Most people, if they went to their doctor for a physical every year for 4 or 5 years, they would have about the same amount of time with their doctor, and they had to pay every single time or, bill insurance every time. They'd have the same amount of time with their doctor as you can get with me for free one time. So that's the other problem with the model and the way that it's set up. People are so sick. There's not enough doctors out there to be spending an hour plus with everyone. So even if they want to do these things, the time isn't there. They need to say, what is the best thing that I can do in 5 to 10 minutes? And let's be honest, if again, go into that example, because that was me at one point, a 15-year-old with their parents exhibiting these mental health symptoms, if you tell them in a 5-minute span, oh, you need to go to bed on time, do you think it's more likely that they're actually going to fix that? Or is it more likely that they're going to go take the medication that they just have to pop once a day in the morning that they can go get from the pharmacy down the road for $5 because insurance covers most of it? The truth of the matter is they're more likely to do that second option. So I don't like admitting this, but in a sense, Western medicine, based on the system that they operate in, is really doing the best that they can, as horrid as the results are sometimes.
As I'm digesting everything you said, which is really insightful for me, particularly having limited or no expertise in that area. It almost feels like when you kind of give patients the standard aftercare, which would be the medication, which to me is more preventative and probably isn't the cure. The cure would be, to my mind, would be some of the things that you've said about maybe looking at your diet, what time you're going to bed. That's probably going to have a more profound impact. And it almost feels like a false economy, because if your intervention is always preventative, you're going to see Paul or Evan more where the treatment they were getting is more preventative. So if you went and you looked at maybe compelling information about diet, compelling information about time you go to bed, potentially from a doctor's perspective, you're not going to see Paul and Evan as much as not that much, because the treatment and the advice and is probably more in line with what's actually a cure regard and not preventative.
Yeah, and this is where the systems also have different philosophies around all this stuff. Western medicine is coming from the perspective, again, of diagnosing and treating. They also, and this is very individualized, so I will not sit here and speak for all Western medicine practitioners. That'd be ridiculous. But the system generally believes that a lot of the outcomes that we have in health are kind of an ultimatum based on your genetic lottery, and you got unlucky and now you have autoimmune conditions. So if I went into a Western medicine doctor and said, you can cure autoimmunity, they'd say, you're out of your mind and you're arrogant. You don't have a degree in this. What are you talking about? Now, Paul, I'm not making a medical claim. It is a factual statement to say we have worked with clients. I mean, you probably, depending on how many episodes or which episodes you listen to, you might have heard these testimonials yourself. There are people out there that we work with in a very holistic manner that don't have the autoimmune disease anymore. Now, Western medicine can say, well, that's just in remission. The difference with remission versus curing is like you kind of get to label it this different way where it's like, oh, well, yeah, it's just not as active anymore and we don't understand why it's active. Okay, well, remissions aren't supposed to last the rest of people's lives. Normally, if they're going to live for another 40, 50 years, you'd expect to see it again. Yet we have people that work with us that for 10 years haven't had the symptoms of their autoimmune condition and in fact have better lab markers than 20 years ago before they ever got into this holistic stuff. So that's the other problem, is the philosophy of Western medicine does not necessarily always believe that things can be cured, whereas the philosophy of functional medicine, or at least I'll speak for functional diagnostic nutrition specifically, we believe that the body's created perfectly and the body has an innate healing mechanism. Now, people might say that, whoa, that sounds spiritual or hippie woo-woo. Okay, maybe the first part spiritual hippie woo-woo. Let's go to the second part then, that it has a healing mechanism. I don't need to prove that to you. You've already experienced it. And people are always like, what? No, I haven't. Have you ever had a paper cut or a broken bone or, a pulled muscle or something? The cast that your bone was put around or your arm was put into, if you broke your arm, that did not release some magical chemical that heals your bone. All it did was put it into place because the bone's going to heal by itself. Your body actually knows to heal that. It can say, something went wrong here. This arm got broken. We need to fix it. Now, we come in with Western medicine, and this is a good thing, and we put the cast on so that it actually heals correctly, because otherwise you could heal all messed up and it'll heal all right, but you'll look crazy afterwards or your arm can be all crooked. So thankfully, we can put them in casts. Again, same thing with a paper cut or any other type of cut. You don't have to say, hey, paper cut, you need to heal. You go to bed, you wake up, wow, that's a little better today. You go to bed the next day, you wake up, hey, that's a little better today. Until all of a sudden, I might have had a paper cut on my finger weeks ago and I can't even see it anymore. Even the scab might have healed. Even the scar might have healed. So that's the difference in philosophy. Is Western medicine generally, again, not speaking for every individual doctor or nurse, generally says, okay, the body is now broken. We need to fix this with some type of medication or surgery. Whereas functional medicine says, hey, the body is designed perfectly. In most cases, obviously, there's real deficiencies that people come out of the womb with. I recognize that. But in most cases, the body comes out perfectly. It certainly has an innate healing ability. We can prove that. And so if we give you, it's almost like a math equation. If we plug in the right stuff and give you the right formula, in theory, your body should heal again. It's a difference in philosophy that leads to this.
Okay. So can traditional medicine and functional diagnostic nutrition, can they coexist together?
100%, and in fact, they should. We have more and more doctors coming through the FDN course. I actually just interviewed recently 4 nurses. They all work together. They're all friends, and they all had their own health challenges, and they ended up doing this stuff. So Western medicine, if I had to explain it very simply, it should be for cases of acute injury or illness. It should be for extending life to a reasonable amount. It should be extending quality of life. And it should also be for, again, emergency situations. So this is where I'm very pro-Western medicine. Most people don't know that in the early 1800s, which of course to us listening, it sounds like forever ago. Guys, that was only 200 years ago. Early 1800s in America, there was a 50% child mortality rate by the age of 4. In layman's terms,
what 50, sorry.
50.
Wow.
And so, yeah, Paul, in layman's terms, what that means is that if in the early 1800s in America, I have a kid, 50% chance that kid's going to die by the age of 4. So Western medicine has done some amazing things. We've had crazy outbreaks of different bacteria. There was the plague. There's all these different types of things that have happened throughout history. So yeah, Western medicine's done some very cool stuff. Modern sanitation's done a lot too for all of these things. So it's not inherently bad, but it should be reserved for probably stuff like that. Or gosh forbid I get into a car accident. I'm not going to go to an FDN practitioner.
Mhm.
I need to go to the hospital, man. I might be in a dire situation. So it's for that stuff. But if it's a chronic illness, I would probably be going to functional medicine first, or then the last example I'll give, just because I want to show people I am trying to be objective with this. Let's say I'm in late stage cancer and I just got the diagnosis. Okay, whoa, that's not early stage cancer. That's pretty scary. Now things are really changing in your body. That's a perfect example of when you need to stay up to date with your Western medicine doctor 100% of the time. But what would it possibly hurt to also start doing the natural stuff and support your body as much as we can during this time that you're very sick? So there's times and places where it's one or the other. And then there's times and places where it's like, no, you need both. And you need to do exactly what both of them are saying. Otherwise, you might not make it through this diagnosis. So yeah, it's nuanced.
Okay. So in relation to, you mentioned that you are starting to get doctors, nurses, and so forth that are coming to see you because they want to either engage with FDN for maybe from a personal perspective, or maybe they want to engage with it maybe from a work perspective. Is it both of those that you're seeing doctors and nurses that are wanting to engage with you to find out a little bit more?
It is both. 98% of it, at least, it might even be 99, starts with a personal story, because you brought up something very important in the beginning. And I don't know if you realized how important it is, because it's important to me. You talked about this idea that doctors are these authority figures, or I forget the exact words, but they're smart, right? You don't want to challenge them.
We don't.
And then again, this is another place I piss people off. You really shouldn't. The next part that you said was something people really, it takes them years of doing this stuff to actually get it. You said, unless it consistently doesn't work, that's when you should challenge it. So if I go into the doctor as a 15-year-old, and it's the first time, I'm making it up, first time I've ever been to the doctor, and they tell me something, no, who the heck am I to be challenging an individual who went to school for 12 plus years, did residency, spent hundreds of thousands of dollars on the degree? That's arrogant, and you're definitely lowering your odds that you're going to have success with this. But what happens to many of us, and then again, these Western professionals as well, they experience it firsthand. When they do the things that they know to do for the symptoms that they have, and they realize that the standard of care is not great, they realize that they're not getting better, or in the worst case scenario, they are getting worse. That's when you start to challenge. That's when you start to think outside the box and say, well, wait, what's going on here? Because for me, Paul, it's not like I was the smartest 18-year-old in the world, but at 18 years old, I decided to move away from this and start branching out simply because I got my 7th different diagnosed condition. So I had like 3 or 4 mental health conditions or 3 or 4 physical conditions all at once. And at 18, I'm like, there is no way I'm just this unlucky genetically, or that these conditions are all separated. And maybe that was arrogant at the time. I just couldn't accept it. I had no basis for that. I just thought it was ludicrous that I could have all these different health conditions where most of my friends didn't have any at all, or maybe they only had like one. And thankfully that at the time, arrogance ended up being the foundation for my healing, because I just couldn't accept that. So that's one thing that all these people have in common that come to functional medicine, whether they were in Western or not to begin with. They almost always have personal experiences, or there's 1% to 2%. The reason that they came is because they saw it in their patients. They saw that the things that they were teaching their patients or prescribing to their patients weren't working, and they had the humility and curiosity to branch out and say, this isn't working, I need to find something else. And I give huge props to both sides of that, because it's pretty damn hard to pursue this regardless of how you get into it.
Yeah. So when these guys, doctors or nurses, come to see you because they want to maybe investigate from a personal perspective, then you engage with them, it opens their eyes. What's their reaction like when they realize that a more holistic approach is required? What type of insight do you get from them? Are you getting insights that they would love to do this, but the system really doesn't cater for it, or doesn't give us the bandwidth that we need to maybe bring this in and make it really a part of the care that we give patients when they come and see us?
Well, that's what's particularly impressive about these people, and why I said I respect all the reasons that they get into it. Because, like, those 4 nurses that I mentioned, they're not practicing as nurses anymore. These people got an advanced degree that cost a lot of money, probably, and took a lot of heartache to actually get. And they end up practicing the functional lab testing side with just the background of the nursing. Same thing with a lot of these doctors. They'll end up using the functional perspective and saying, oh, by the way, I'm also trained as an MD, or I'm trained as XYZ thing, which is really crazy because the time and money invested to get these degrees is not a joke, especially an MD. It's like a fraction of your life you dedicated to pursuing this. So the ability and willingness to say, you know what, I did do that. I realized that it wasn't wrong, but it's incomplete. And now I'm going to go do this other thing. Again, I can't imagine something like that because I've never experienced it. I find it very impressive. So a lot of them are in that boat. And then there's others that I'll spare you for this podcast because it almost gets, I'm just being real. This is 100% true that it happened to me. It's almost conspiratorial. I can't believe how many Western people that are practicing as Western, and then I've talked to them about this kind of stuff, how many are willing to say off the record that they are very aware what functional medicine is doing is correct, but they can't say that because they could lose their license or job if they started actually promoting this type of stuff. So it's either you voluntarily give up the license and job, or it's kind of it's a nutty thing. There's a lot of money behind all of this stuff throughout the world, especially in America.
So, in relation to, so the people watching, listening, that are very curious around the subject that we're discussing, and they're keen to understand a little bit more about FDN. So typically, when a patient or somebody comes to see you because there's something amiss, what happens at that initial meeting, that initial conversation?
Well, there's the preliminary stuff, like on that discovery call. One of the first things that I'm doing is seeing what the conditions actually are. And I'm also getting kind of the major thing is I'm getting a history on them, because there are different reasons that people get sick. Some are like me, where, hey, it's not perfect, but it's okay. And yet I have these health conditions. And then others, and this is very common in the space, you see this a lot. There are people that have been through enormous traumas and tragedies, abuse, all this stuff in their life, and it manifests as mental or physical health conditions. So when I'm investigating that, I'll always check out to see, okay, did they get the proper help for these things? Are they actively getting help for these things? But if you tell me, and I've had this happen, I might be one of the first people they've ever told that they were abused as a kid. So they've never been to a therapist, never been to a doctor for this, and now they have these health conditions. I'm not going to sit there and charge you for lab testing until you go see what the therapist can do, because these are things that need to be worked out, man. That's that's one of the first things.
So you would refer them if they give you information which is clearly outside of FDN, you just refer.
Yes, so that's like a little asterisk I just wanted to put on this. That's the first thing I'm checking. Now, for the technical side, where FDN is different, especially from Western medicine, but even also a lot of functional medicine, is the founder of FDN, Reed Davis. He refuses to do something that he calls the sounds like method. So the sounds like method, Paul, is you come into the office or we talk virtually and you list off your symptoms. And now I say, oh, you know what, Paul, it sounds like a thyroid condition. It sounds like a heart condition. It sounds like this. And now I base my testing on what you said you have, or symptom wise, and then I'm guessing what it sounds like. This is a really tough one to understand because it's a whole different way of looking at health and medicine. Where FDN is different is we don't really care per se the symptoms that you're listing off, because we believe that the body should be in a good state of health. So the way we approach it is, instead of playing a guessing game on which tests we should or shouldn't run with you, we say, all right, if a body gets sick with a chronic illness, what is most likely to go wrong? So Reed actually, this happened over 25 years. This isn't new for him. He worked with over 10,000 clients. He ran labs with over 10,000 clients, and he started to pick apart which ones were most consistently useful across all cases of chronic illness, whether it was cancer, autoimmune, mental health, gut health, skin health. And what he found was, all right, when someone's under chronic illness, usually their hormones are out of whack, because and most people, if they went to college, experienced this. They go to college and they're staying up till 4 a.m. They're drinking heavily, they're partying, and they can do this a few nights per week, and there's really no like major consequence, right? They're like, oh, I'll just sleep it off on Sunday or something like that. Your stress response, if you were someone who was able to do that, is so good that you're kind of masking the negative effects. So what's happened then, this would be like, if you were in college for 6 years and now all of a sudden you're noticing, hey, I gained some weight from this. Hey, I get hungover off just a couple drinks now. I can't do this anymore. That stress response, your vital reserve, we call it, isn't able to keep up with the stressors anymore. So we look at hormones. We say, okay, the hormone response is going to be bad. Let's see how bad it is, because we need to edit your lifestyle depending on how bad it is. We know that you're going to develop leaky gut almost certainly. And when someone develops something called leaky gut, then you might be actually more prone to hosting bacteria, parasites. And I know that sounds uncommon. This is par for the course in our work. Everyone has these things. So we test for that. We look at food sensitivities that might have developed. And I know I'm listing off a lot, but I want to answer you accurately. We're looking at these things, bottom line, that are very common, almost universal in people with chronic illnesses. Now, there are hundreds of different functional tests out there, and there's a time and place for all of them. We utilize them sometime. But what we do is we say, okay, we're going to start with these foundational labs, we call them, because we know that they're going to work for anyone who's sick. Some people, if they do those labs and we base a protocol of those results, they might get 100% better in 4 months. Some people might get 60% better in 3 months. Some people might get 60% better in 2 months, but they stay at 60% and they need more to actually go further. So what I'll say is this, and no one will admit this, Western or functional, there's no perfect system out there yet. Our system isn't perfect. What Reed did was say, okay, what system can I use that at least gets 100% of people better, maybe to the 60% mark? So again, we don't get everyone 100% better, but we can almost guarantee that if we were willing to take you on as a client, you're going to feel over 50% better within the first few months of working with us. If we need to investigate further, that's why we have our community of FDN practitioners. That's why we have clinical advisors on staff to help us out. That's why we have access to multiple tens of tests extra other than the foundational ones, but we always start there. So that's what it would look like initially coming to an FDN. Sure, we do the preliminary call. We make sure that you're someone that we can actually help and that there's not other stressors or other things going on in your life that are way out of our scope to take on. And then if we decide that you're a good fit for us, we run through the foundational labs.
Okay. So it's thorough. So a couple of questions spring to mind. So functional diagnostic nutrition. So I'm keen to ask a question around the nutrition. So is nutrition a key component of FDN?
Yes, not in the dietitian sense. I'm not sure. Actually, I apologize. In the UK, do you label them as dietitians or nutritionists? Do you have people that go to degrees or university for those degrees?
You know what? I'm probably best placed not to answer that question because
Okay.
I've got no expertise in that space. But yeah, we do have nutritionists and we do have the dietitians, but I wouldn't be able to say with any confidence what the distinction is from a professional perspective.
That's okay. I was just asking in the sense that, like in America, you will need to have a degree. If I wanted to give you a specific meal plan, like if I wanted to say, Paul, this is what you need to eat for breakfast, lunch, and dinner, I have to have a degree. So it's not that. Where the nutrition side comes in with FDN, it's more that we're showing you, hey, in general, this stuff here is great to eat. And for you specifically, this might be bad. So if I run a food sensitivity test on someone and they're having a strong immune reaction to something like gluten, which happens all the time in chronically ill people, it's not out of scope of practice for me to say, hey, this is bad for you. We can see that objectively. You're reacting to this. But what I wouldn't say is, okay, so instead of gluten, we're going to eat, I wouldn't necessarily recommend this either, but we're going to eat gluten-free breakfast every morning. That's or gluten-free bread for breakfast every morning. That's a specific recommendation. So we might say, you know what, Paul, through the labs, we've deciphered that maybe like a paleo-ish, I'm just using one that people know, a paleo-ish diet is the best for you minus these foods. Try that out and make it in any way that you're happy. That's how we do nutrition.
Okay. And it's really interesting because my first knowledge of FDN is essentially researching you, so not something I'm familiar with at all. So when you have patients that you see. You see a lot more patients. You've got a big infrastructure there with lots of different practitioners and so forth. Have these people exhausted the traditional system, or are they people that are a little bit curious or fallen out of love with the traditional system?
Yeah, it's another good question, especially for someone that doesn't have the knowledge around this. These are very, in my opinion, they're astute questions because you're right. No one comes to an FDN practitioner because they're bored, generally speaking. When we're working with someone or onboarding someone, they might, without exaggeration, they might have been to 5 doctors in Western medicine that couldn't help. They might have even been to a naturopathic doctor or a doctor of natural medicine, it's called in America. Like they're going to other places first. They're at their rope's end. And then a lot of the time, what attracts the clients for like an FDN practitioner is we're very big on social media. A lot of us go out and do talks. A lot of us do podcasts. And so it's actually someone finds us by chance and then says, hey, I had severe acne. That was one of my health conditions that I had. So they might have been to the dermatologist. They couldn't help them. They went to the natural medicine doctor. That couldn't help. But now they hear a podcast that I did and they see the video and they're like, all right, like, he's no 10 out of 10, but his acne's gone. So that's good. How did he do it? So they're more coming to us because they relate to our story. Unfortunately, it's out of desperation because they've tried everything else. So the answer is absolutely yes. I don't think I've ever had someone come to me without going to their doctor first, nor would I recommend that. Yeah. You should go to Western medicine first.
Okay. And your situation, so you had the acne, and I think I read in your bio something along the lines of you and your mum were suffering for 10 years for some type of ailment, and you both found the cure after 10 years. Was that using FDN?
Yes, the principles that are taught in it, as well as other natural and lifestyle stuff. But yes, overall, FDN was the foundation.
Okay, lovely. So how did you guys come across FDN in the beginning?
Oh, that's a podcast in and of itself. I promise I'll keep it short.
Okay.
I just started experimenting at 18. Again, that was when I got that 7th condition. I'm like, okay, what can I do? I went on Google, Dr. Google, YouTube University. I started looking up dietary stuff and health conditions. I was reading forums. And then I pursued a certification online for something called the Institute for Integrative Nutrition, which is probably like the most popular health coaching program out there. It worked pretty well for me. It taught me a lot, but it didn't get me to where I needed to go. So the true story is of how I found FDN is I was so committed to natural medicine at this point because I knew it worked for me to some degree. I felt like I was just missing some pieces. In America, I'm not sure if these stereotypes get all the way to Europe about America, but in America itself, if you asked anyone here, hey, where are all like the natural health people? Where are all the hippies? Everyone would say the West Coast of America, like California, Oregon, Washington, they have all the hippies. And so on the East Coast, where I'm at, Pennsylvania, I just thought, okay, there must be people out there that know more than me about this. So I literally called up my best friend at 21 years old and I said, dude, I'm going to California. I don't know how I'm going to afford it, but I'm going and I really need some support. If you'd like to go, let's do it. He called me the next day, said he put in his 2 weeks at his job and he drove across with me, true story. And we started going to random health meetups. And I met a woman who had Hashimoto's thyroiditis, which is an autoimmune condition of the thyroid. And she also had skin cancer, but she no longer had those things. And instead, she was now helping other people. I walked up to her afterwards. I said, how the heck did you do that? Because if you could heal those things, I could probably heal my stuff. And she said, I am an FDN practitioner and the rest is history. Then I pursued the course.
So clearly, sometimes we just have a knowing and we have to go after that. And clearly that was the case with you. So just in relation to, so this episode is Decoding Mysteries, Health Mysteries. So in your, I guess, journey with FDN, is it kind of worrying to you some of the mysteries that exist, or maybe some of the areas that aren't explored because we are fixated on doing things a certain way?
You cut out for a second. You said, is it what to me?
I guess, is it, I think, the best word to describe it. So on your journey where you've been, your journey of FDN, I guess you've seen a lot of myths potentially in terms of health and in terms of how we can cure ourselves or how we can actually engage with health on an improved way. What's that been like for you? Has it opened your eyes, and are you kind of curious about some of the mysteries that do exist that probably for the layman we don't challenge those?
Wow. Yeah. Interesting. So the answer is yes. And that's why the podcast is so cool, because we've been doing that for 3 years now. And I
Yeah.
interview like all these different people who have been through crazy stuff and overcome it. So I would say to this day, I'm still continuously challenged, even myself, because I don't know what the upper limit for this is. I'm almost like, what can't you heal
Mm.
at this point? Because we've had people on the podcast. Autoimmune conditions, I almost consider that universally reversible. And I know that's like a bold statement. If someone has that, they might even interpret that as insulting. I don't mean that as insulting. I mean that as encouraging. Please go listen to our stuff or just listen to other people's stuff. These are widespread stories now. There's a lot of information out there, so you can find it if you're looking for it. But then there's cancers, and cancer's a lot more complicated, in my opinion. And I wouldn't claim to be as educated on that as I am the autoimmune side. But there's people that have been on my podcast that they were told at one point they had 4 months to live. And we were doing that interview 6 years after they were told that. And it's like, whoa. So I don't know what the upper limits on this are. Now, in terms of the myths, there's a lot of people that come to us and they'll just say, I'm trying to get better as much as I can, but I know I'll never get rid of this. And I'm like, I don't know that, because I've seen people get rid of this.
Yeah.
And I have to be careful with the wording, because there's legal sides to this, and there's some accuracy to those legal sides. Remission is different than a cure, so you got to be careful. But I think a lot of people have no idea what it means to actually be healthy. And because of that, they have no idea what's actually possible. This is not particularly easy. The action steps aren't hard per se. That's not what I mean. I mean that we live in a world now that is the absolute opposite of what we need to be doing for health. And it's so normalized and so a part of our social lives that for some people, when they find out what's necessary to heal, it's not everyone. It's almost worse to them to have to go do all that crap than it is to have the health condition. So I think people, in terms of the myth thing, they don't understand what can actually be resolved or put into remission, because they don't see people doing it often, because it's really damn hard. You got to be really committed to this or in a lot of pain to the point that it's worth it.
Yeah. Could you ever envisage a day where you would have FDN departments within hospitals or within private practices, where you would have this almost organic process where if a patient came in with a challenge, this might not be the right way that it would work, but potentially they might come to see the FDN consultant initially, get an appraisal there. If it's something that isn't really problematic, that really does need traditional support, then they would stay with the FDN.
The hospital one, I can imagine it. Yes, I'm not aware of it happening yet, but there's a great answer to your question. It's already happening already
Really?
with the private practice one. We have many FDNs that work directly with doctors. And then we have some doctors, this is less common, but we have some doctors that have like 5 or 6 FDNs hired under them, because they saw the light, so to speak. They realized what this could do for their patients. And so now it's like, they are able to take on so much more and help so many more people, because they have like 5 or 6 FDNs working under them. But I know a woman named Heather, and she's public. That's why I'm using her name. So Heather Cohen, what she does is she is a very sharp cookie, very well educated, and she's an FDN practitioner, and she works directly with an oncologist. So that was that example of the cancer stuff that I was referring to, where this clinic, when they take on someone for cancer, they work with the oncologist, but they also work directly with Heather as an FDN practitioner, and both of them guide the individual through their journey. So I can see it in the future in hospitals, simply because we're already seeing it in the private practice stuff. I will say, the higher you go up the food chain, though, of corporate business, the harder it's going to be. A private practice might be ran by Dr. Paul, and Dr. Paul can do whatever the hell he wants. But a hospital that has boards and chairmen and people that make decisions and say, well, wait a second, how do we actually make the most money? Because I'm sorry, guys, they're businesses and they have to think that way. That's going to be a little tougher.
Yeah. Okay. So that's tricky, because you're looking at finance, you're looking at pharmaceuticals and all that with medicine, and there's obviously lots of money that goes into that. But I'm just thinking, I guess it gets complicated, because as you were answering that, I was thinking about the political system in that, because ultimately what it should boil down to, in my opinion, I'm being kind of idealistic here, it should boil down to people getting the right treatment, people's quality of life, people not having to spend years and years and years going back and forth, back and forth, back and forth, and actually not improving, and actually probably getting worse because the situation isn't diagnosed or treated effectively. Either you maintain or I guess you get worse. My last point on that, have you had, I haven't listened to all your episodes, so maybe there might be an episode you can point me towards, but are there any episodes where you actually have doctors on that maybe are from more the traditional background in terms of the medical care, and you debate with them?
Not debate, but I've had many doctors on that are in full support of this. But I
Yeah,
will say it all comes down to them having a personal experience as
yeah.
well. I'll know. I asked what the heck's her name? It was on like episode 100, which was 200 episodes ago. I think it was Doctor. It's something Dunstan, but she was on, and I remember I was so impressed with her because she was a traditional OBGYN and she was fully into holistic medicine. And I said, how can we go and have conversations with Western medicine to show them that this works? And she said, Evan, you can't. She said, you're wasting your
Mm,
time. You would need for them to have their own experience. And she made it clear. She's not like, she's not wishing that on them. She's like,
mm,
they're not going to listen. They need to see this first. And I'm like, wow, okay. I think that's a bit more of a negative view than is warranted. I do think there's people that see the light, so to speak, but she's not wrong in general. She's probably right for about 90+% of cases where if they don't have something happen to them personally or within their own family, then it's not going to change as much. Now, the debate factor would be interesting, but usually if I was truly debating a doctor, we would actually come to pretty common ground
mm.
because I can't even debate them on a lot of the treatment side. I don't pretend to even want to. I think they're correct on a lot of things. I would just be making the case that do you think more lifestyle stuff could be implemented to help disease? Almost all of them would say
Yeah.
yes to that. But again, this comes back to our initial points. There's not the time to do it. It's not a 5 to 10 minute conversation when you have 30 patients or 50 patients you need to see that day. So there's not a huge debate around that. Where there would be a huge debate is what's possible in terms of curing, resolving, putting into remission a disease. And I could only debate that with anecdotes, admittedly. Like you need the published research to back up some of this stuff. And so I don't really talk about this publicly, but the podcast was done very strategically because when Reed allowed me to pursue that position in the company, he said, you can make it about whatever you want. I just want people to know about the course. And ideally, I'd want people to buy it. Eventually, that'd be great, but you can do whatever you want.
Mhm.
And I said, all right, we could go and do what every other health podcast does out there, which is like give these little tips and tricks, which we have. But I said, if we start telling stories, eventually, when we've been doing this for 3, 4, 5, 6, 7 years, you can't deny that this isn't an accident anymore. I said that wrong. You can't say that it's an accident or a one-off case. There's 300 stories on there right now. That's pretty hard to
Right.
fake.
Yeah, yeah, absolutely. So for people that haven't listened to the podcast, maybe you can say a little, I guess you have given us a snippet about that, but for people that are keen to listen and maybe find out more, what are they going to find? What are they going to, I guess, discover?
Listen, if you're somehow listening to this and very advanced in the topics of biohacking, functional or natural medicine, our podcast is cool. It might not be your first listen. Who I'd recommend it for are the people that are actively going through a struggling time with their health and they need hope,
Mm,
or people who have a health condition and never even thought that it was possible to resolve it. There's thousands of health conditions
okay.
in you could get diagnosed with, so we don't have all thousands or all of the thousands on the show, but a lot of autoimmune conditions are on there, a lot of skin issues, gut issues. So if you just typed in the Health Detective podcast and then your condition right after it, you might find an episode on your condition and you might find someone that resolved this where before listening to this episode of My Perfect Failure, you might not even have known that there was anyone who resolved it
Yeah.
naturally out there. So yeah, that's who I'd recommend listen to it.
Okay, perfect, perfect. And Bucks County Light Therapy and Medicine, is that the name of the clinic or is that something different?
So that's my personal company with a business partner and my fiance.
Okay.
We actually do, we're kind of the rare FDN because most FDNs work completely online. We do have in-person stuff. We do alternative therapies there, like red light therapy, infrared saunas. It's more just, it's fun to have. It's a cool thing
Okay.
that I wanted to do. But we work with people remotely and online with the lab side all over the world, mostly the USA and Canada, but all over the world. And so you technically could reach out for that type of stuff too. But that's our in-person business. It's like my science experiment. I just think it's fun, and I've always wanted to do it.
Okay, fantastic. And so you're based in the States, and I'm in the UK. So FDN is it? Are you aware that FDN is practiced in the UK as well, or in other parts of the world?
It absolutely is. So our biggest countries in order would be America, Canada, Australia, and then there's a variety of countries that I actually don't know where the next standings would be. But the UK is definitely up there. We have many practitioners that are out there doing it right now.
Okay, cool, wonderful. Well, I would definitely recommend that everybody listening, watching, tunes into your podcast because they get more insights and you go more in depth than we've been able to cover today. Fabulous. So, Evan, for people that want to contact you, want to find out more, where's the best place for people to come to find you?
The best place right now, honestly, social media is actually a great one. It's just something that I check regularly. So it's Evan Transue underscore on Instagram. And the reason it's that is because I lost the other one that I had as my normal name.
Okay.
So Evan Transue on Facebook there, or even just sending us an email on our Bucks County lighttherapy.com website is great. But yeah, that's the way to do it.
Okay, fabulous. Well, I will put everything on the show notes. So very easy for people to find you. And Evan, I kind of mentioned it before we hit the record button. I do have a recurring question on the podcast, which is if you could invite three inspirational people for dinner, they can be live or past, who would you invite?
You know, it's so funny. I just started to remember that you asked that in the beginning before we got on at the end. So I do have it for you because I knew the one right away. It drives me crazy. And this is because I love public speaking. It's one of my favorite things in the world. It is the only thing that I've ever been motivated to do long term. So I actually would say one of the first ones would be Martin Luther King because of yes, the topic was timely. I get that. But there's many people that could have spoke on that topic. When you listen to his speech, I Have a Dream, that's next level of, I mean, he moved a country, he moved a generation. So I'm not going to be sitting there and doing the same type of things that he was doing, but I just want to know that depth of speaking, what he knew. I'd love to know that. Second one, this isn't in order necessarily because respectfully, I'd probably have to pick the second person first, Jesus Christ. And that's because I'm a born again Christian as of 2 years ago. And so I don't care what anyone else is, doesn't matter to me, but I'd love to meet Jesus. That would be the coolest thing in the world to be able to have a conversation there. And hopefully that does happen one day. Maybe not while I'm on this earth, but hopefully that does happen. And then the third one, this is kind of a weird one. I have a weird mix of interests. I think I'd like to meet the Tai Lopez guy. Have you ever heard of him? He's an and a lot of his entrepreneurial stuff, unfortunately, especially over the last several years, was very cheesy. He did a lot of stuff with just like, the hot girls and the sports cars or whatever. And I don't think he's a bad person, though. I think he's very intelligent. I think he knows what sells. But I started liking him when I was like 18 years old. I went through his 67 steps thing. I think he's a thinker. I think he's a highly intelligent person. And I love his connections to all these different mentors that he has. So I think it'd be very smart to meet him. And perhaps, with all due respect to Tai Lopez, if gosh forbid he ever heard this, I don't know that he belongs in the same category as Martin Luther King and Jesus, but if I'm just being honest, I think that's one of the people I'd love to meet because I love his focus on personality, psychology, and then the connections that he could get me to eventually if I proved that I was worthy to him. So that is my very odd mix of three people.
I'm just thinking and the thing is, he clearly is a smart guy, but I'm just thinking what Jesus and Martin Luther King would make of his.
Different. Probably, hey, that's off the spot, or that's off the top of my head. No, off the spot.
Good. I like it. I like this. Lens. Evan, it's been fabulous meeting you, learning. I did say before we hit the record button, I was keen to learn about this because FDN definitely had no knowledge of it before we decided we wanted to collaborate on this podcast. So thank you so much, and definitely let's stay in touch, and it'd be definitely wonderful maybe to have another discussion at a later date.
Thank you so much for having me.
Wonderful, wonderful. And thank you, everybody, for tuning into this episode of My Perfect Failure. If you're watching this on YouTube, please do subscribe. This really helps us grow the channel. And if you know anybody that is looking really to find out more about health and about different ways that they can really explore how they can improve their health, please do share this episode with them. And your feedback is most welcome. So we're keen to hear about the things you like and equally the things you don't like. So you can find me at paul@myperfectfailure.com, or you can find me via the contact page on the website. So take care. Bye.
Thanks for listening to My Perfect Failure podcast. Be sure to visit www.myperfectfailure.com to join the conversation. Subscribe to our podcast on iTunes or Google Play. Look out for our next episode.